Hi, I'm Gil Kennedy, President and CEO of Har-Co Credit Union. I want to welcome you today to our third podcast in a series that we're running as it relates to how we as individuals need to migrate through this journey that we all seem to be on. Today we have Dr. Kevin Lynch and Dr. Kendal O'Hare, who are from the Lynch Primary Care Organization located at 31 Lee Street. We're honored to be able to provide you with these podcast series with our partner, Harvard Lifestyle Magazine. We hope that you enjoy it and share it with your friends and family.
In this episode of the Harvard Lifestyle Magazine, we're with Dr. Lynch and Dr. O'Hare of Lynch Primary Care. Doctors, today, share a little bit about the practice here in Bel Air and how long you've been here, and a little bit about what Lynch Primary Care is all about.
Well, I guess I'll start. I'm a Harford County guy. Grew up in Harford County, did all my training in Virginia, came back here 32 years ago, so I've been in practice of general internal medicine, primary care for 32 years. Very busy practice with Harford Primary Care for 20 years. Went to the hospital for a number of years, doing some administrative work there. And decided at that point I wanted to continue primary care, but needed to have a smaller practice. And this type of concierge or retainer practice is what I started based on a physician's practice down in Towson that I mirrored. And started this 11 years ago. And instead of the usual 3,000 patients in the practice, have about 350 patients in the practice. So we can spend more time with patients, have patients be seen same day. It's a much better style of practice compared to what's out there in the mainstream. Great. And it's been a big hit with the patients. Patients love it, and I love it. And been successful enough, I was able to bring on a star partner in the past 2 years.
Dr. O'Hare, how did you get to Lynch Primary Care?
So I finished my training up in New Jersey, and when my husband and I finished training, we were looking to a place to move, and he's also in medicine. So we were interviewing different places, and we really liked Baltimore, we liked the area, so we moved here. And I previously to this job had been with MedStar, where I was a faculty family physician teaching residents and medical students. But I missed having the connection myself with my patients. So I was looking for something different. I wanted to be a little closer to home. I have 3 children, so I wanted to be close to home to be with them. And met this guy and heard about what he did, and I happened to be right place at the right time, and he hired me, and I've been here for a year and a half now, I think. It's great. I get to practice medicine the way I've always wanted to practice medicine, putting the patients first.
That's awesome. And today we want to talk about this COVID situation, and it's unprecedented in my lifetime, in our lifetime. And what's the latest? What can you bring us up to speed a bit about where we stand today?
Sure. Yeah. I just want to start off with sharing a little bit of the numbers about where we stand currently. So in the United States, we're right at about 1.8 million cases, and we just reached 108,000 deaths. But here in Harford County, we are at 191 cases confirmed and 48 deaths. It's important to know, though, that our local hospitals, both Upper Chesapeake and Harford Memorial, we're still seeing active cases. We're still seeing patients being hospitalized, both in the intensive care unit and the regular medical surgical floors, who are actively getting treated for COVID. So it's still here. It's still quite active in our community.
Great.
And the number of patients in Harford County, I think, is 890. Did you say 891? 891. Okay.
Yeah.
Okay.
Gotcha. And on that curve, we actually are on the downside of the curve. A lot of folks, is that right?
Yes, we are still on the downslope, both in terms of the United States as well as here locally in Maryland.
I mean, there's still new cases identified on a daily basis, but the fact is there's fewer people being hospitalized. Our ICU beds are no longer overwhelmed. There's still people in our ICU with COVID infections, but it's no longer the high volumes that we had.
Right.
So if one of our members, one of the people in our community thought that they were exposed to COVID, what's the incubation period? We've heard different amounts of time. What would one do if they were exposed?
Generally, you hear there's a 2-week window incubation period. Typically, somebody that's exposed starts getting cold symptoms by day 4 or 5, typically. But there are cases where, it's not till day 10 or even day 14 where they're showing up with symptoms, which is why we have pretty much a 2-week window of time that somebody is exposed to say, keep your distance from other people in case you happen to be carrying the virus. Typically 4 to 5 days before symptoms pop up.
Gotcha. So you said symptoms. What's the clinical presentation of COVID? What does it look like?
So typically, once you've been exposed, you can expect to potentially have symptoms if you're going to show symptoms after about day 4 to day 5 of exposure. As we know, a lot of people don't even have symptoms; they remain asymptomatic. Some people will get the typical symptoms. There's typically 3. We call it fever, fatigue, and a dry cough. That's the typical, more milder symptoms. About 20 to 30% of people will progress a little bit further, and where they will begin to complain of maybe shortness of breath and maybe chest pain. And I think it's important for people to know that when you reach that point, if you start having that shortness of breath and chest pain, that's the time to really seek more of a hospital evaluation, because we have seen where patients go from just shortness of breath and there's a short window where they go into really acute respiratory failure. So that's important to know. We also know that pneumonia is the main manifestation of the disease, so that also leads to the shortness of breath. And we do know that the fatality rate is about 2 to 3% based on the numbers that we have.
How do we tell the difference between COVID and other diseases and illnesses that are like COVID, like the flu? What's the difference? What presents differently?
Unfortunately, that's one of the bad things is we can't tell. A lot of the symptoms like COVID, you'll see in influenza or just a regular respiratory illness, like we talked about fatigue, fever, and cough. Fortunately, now we're kind of past flu season, so we aren't really seeing active flu cases anymore. Whereas when this first started, February or March, we were certainly in the height of the influenza season. But unfortunately, there's no difference. The symptoms do show up in all 3, whether it's allergies, an upper respiratory infection, and even COVID.
It's why testing is critical.
Right.
And when I get these symptoms, are you advising patients then to stay at home?
Right now, very much so. Stay at home and assume it's a bad cold, and also worry that this could be COVID infection or flu. Now, if somebody's very sick and we think they should be tested, we'll get them to the center where testing is done for COVID infection. Or if it's something that is more suggestive of flu, let's say their COVID test is negative and they have flu-like symptoms, might send them for flu testing as well.
Gotcha. And at what point do I go to the hospital?
Well, the biggest trigger really is shortness of breath. If somebody says, look, I'm having a hard time breathing, I'm short of breath, that's time to go to the hospital. The other things would be really just a persisting high fever. If there's confusion along with it, disorientation, it's time to go to the hospital. And
we've heard a lot about different tests for COVID. There's different, everything from the swab in the nostril to I saw a machine that was actually used to. What are the different tests for COVID?
So basically, there's 2 different tests. There's one test that we use to test if you have active COVID-19, and that is usually done with a swab, where it's usually the nasal pharyngeal, and that's the test if you actually have the active disease. The other test we call serology, or it's a blood test, and that is mainly to see if you had COVID-19, to see if you have antibodies. But those are the main 2 tests out there.
If someone, what advice would you give to someone who feels like they've been exposed? Obviously, to stay at home. What else? Is there any home things that they can do to help this process?
Not really. I mean, the main advice, if you've been exposed to COVID-19, first of all, you need to self-quarantine for ideally up to, potentially 14 days, at least 10 days. And get adequate sleep, healthy diet, those things that we know maintain your health, which help your immune system to fight this thing off should you show up with symptoms of it.
Right. And just maintaining proper precautions at home. If you think you may have COVID, washing your hands, making sure you're washing things in the home that everybody's touching to prevent kind of exposure, those type of things. And also just being in touch with your primary care provider so they know what's going on. And just like Dr. Lynch talked about, when those symptoms start to change, to get worse, more severe, that shortness of breath, that's your turn. That's your clue that you need to seek hospital evaluation.
What are antiviral treatments suggested, or specific therapies beyond just staying at home? When do they come into play?
Well, there's nothing absolutely, and you've heard this many times from some of the experts nationally, there's nothing that's absolutely proven 100% to work for COVID-19 infection. In the outpatient world, there was evidence at one point that the hydroxychloroquine might do some good. We sort of veered away from that because that raises potential complications. There still are people treating COVID-19 with hydroxychloroquine, but it's on shaky scientific ground. So generally, it's somebody that's in the hospital that's very sick, where we use medicines like remdesivir or potentially infusion of antibodies from someone who's recovered from the illness. There are a couple other medicines that are used as well, but those are the two, remdesivir and the recovered patient serum antibody infusion are the things that we know have pretty good track record so far. And we do have these locally available, by the way, being part of the University of Maryland system.
So if I have the antibodies, if I've had it or I've been exposed to it and did the incubation and I'm coming out of it and feeling better, can I get it back?
It's a good question, and there's they're constantly doing research and trying to figure this out. So we do know that if you've had COVID-19, your body will develop antibodies against it, so it will allow some protection. We just don't know yet at what level you're protected, and unfortunately we don't know how long that protection would last. But I think as we get more information, more people are tested, we're going to get more answers to that.
And now go ahead.
I was going to say, and we do know from multiple viral infections that we've dealt with over the years that generally once you get a viral infection, respiratory illness, once you get antibodies to it, you're not getting it again.
Right.
That's generally the case. Now, is that going to be the case this time around? We don't know. Virus is a little bit different, but I think it's likely the case. But we don't. Nobody knows that for sure.
Right.
Now, our constituency is sitting out there wondering when they can go out again. When can I go to the beach? When can I go out for a picnic? When can I go out and enjoy a night out with my family? What advice would you give folks right now? When can they go back out?
It's a great question. So I think the first thing to remember is there's no such thing as zero risk. There is risk. There always will be risk at this time. I think it's important to go back to what we talked about, the older population, they're more at risk, so they need to be more careful. And anybody that has some specific chronic medical conditions, such as if you have heart disease, lung disease, kidney disease, if you have hypertension, diabetes, obesity, or cancer, we know you are at a higher risk of getting disease, potentially having severe or deadly complications. So they certainly need to be more concerned about where they're going. There was this nice write-up in NPR that I thought was worthy to share, and it kind of broke it down into two things. It talked about time, space, people, and place. And so I think what they're talking about there, if you break it down, time, you want to minimize the time that you're out and potentially exposed. Makes sense. Space, you want to make sure that you have space between you and other people when you are going out to the grocery store, to go pick up your food, to the pharmacy. The other thing is people. Limit the amount of people that you're exposed to. I like the example of if the grocery store is empty at 7 o'clock in the morning when they open, well, that's when you should do your grocery shopping, or 8 o'clock at night when everybody else is home having dinner, etc. And lastly is place. We know that being outdoors, you have much less exposure potentially than being indoor. And I'll share one more thing about the place that I thought was a simple analogy, but I thought it made sense. If you're in an office space, just like we are here, and somebody sprays some perfume, we're likely to smell it, and it may continue, it may linger, we may continue to smell it. If we're outside of the park or a beach and somebody sprays that same amount of perfume, you might not even smell it, and if you do smell it, it's certainly not going to linger. So I think that just kind of puts it into perspective in terms of exposure.
And doctors, you both have families, you both have children, what advice would you give to the folks out there that have families and children about things like summer camp? Is it time to allow the youth to go out and go to summer camp, or would you still take caution?
Tough decision, and this depends on your comfort level and the how comfortable you are with how they're handling spacing and accommodations at summer camp, and so not a yes or no answer. It's an it depends answer in my mind. There's always, and there is no such thing as a no risk proposition here. I think it can be low risk, and there's certainly lots of venues and stores around in our practice, for example, that have changed their practices and to minimize risk for people. I'm a Home Depot guy. I go there probably a couple days a week, and they've done a great job of spacing people out, making sure people are wearing masks, and no more than 100 people in the store at a time. And I think we're going to see a new norm across the board. In every facet of life, at the library, at restaurants, etc. I would probably be comfortable sending my child to summer camp if I was comfortable that they were doing things correctly at that summer camp. And I think the majority of people are responsible and will do the right thing in terms of distancing, having soap available, the things that you need to do to minimize risk.
Right, going back to Dr. O'Hare's comments from the NPR article about the three important components of making sure that there's safety. Ultimately, how do we get past this virus? How do we defeat it?
Well, I think and certainly you don't defeat this virus. I think we contain it over time. It has become less of a problem, at least locally. There's still probably pockets in the country from time to time where it pops up. We may see a big flare-up of this in the fall, possibly, some of the experts are saying. But also, ultimately, what we're doing right now is working. And eventually we'll have a vaccine. And I'm hoping that sooner rather than later. I hope it's by the end of the year. But, there's all different stories on that one. But really, with availability of vaccine, more widely available testing, and maintaining the new norms that we've put in place, I think we'll be in good shape. And I think we'll, in another year and a half, we'll be at the point where things are starting to really open up a lot more.
In this Harford County community, and this is my last question.
Yeah.
Okay, if we could summarize the important things that, from your perspective, that we should be aware of at this point in time. What are the most important things as we wrap this up that you want to get out to the audience?
I think, as I'll share my kind of closing thoughts, which we may share, is I'm excited at Hartford that in Maryland we're opening back up. We're moving forward, as Governor Hogan had hoped. But I think people need to remember it's still out there. It's still a risk. So people need to continue to take the proper precautions that have been laid out. But I do think we're moving in the right direction. Like Dr. Lynch said, I'm hopeful. I think our numbers are coming down. We're still seeing infection, but the overall numbers are certainly, coming down as we had hoped. And I just think people need to take the proper precautions with, again, people, time, space, and place.
And my final thoughts also do the things that we know minimize risk. We've already talked about them. So just simply follow the rules and use common sense also. Certainly if you're driving down the road in the car by yourself, you probably don't need your mask on. If you're out jogging on Tollgate Road near my place, you probably don't need a mask on. I see people doing this, which it's a little lack of common sense. But most importantly, follow the rules. We cautioned people last time when we did a video of some of the misinformation that's out there. So there is misinformation out there, unfortunately. It's the social media. So just be aware of misinformation, and if you see something that just doesn't seem right, call your doc. Ask your doc about it. And also, know that we will get through this. There are some new norms that we've all become adjusted to. And I will say I went to I was fortunate enough to play golf yesterday afternoon. At the end of that round, we were able to sit out on a patio and have a little bite to eat and a drink in a public setting. First time I've done that in months. But the people are distanced, and it was done in such a way that the risk is minimized. So we will, we will get through this in a very positive way, I think, as time goes on. And lastly, I would suggest that there have been some benefits that have come from this whole terrible thing. And one of those is people are definitely more health conscious these days. There's more people out walking and riding or bike riding, and that's a big positive. And I think if we can maintain that, that would be a positive outcome from this. And also staying in touch with others. I think we've done a pretty good job of that, of keeping in touch with family members and friends like we haven't before. Another positive outcome. If we can just maintain that, that would be a big positive in my mind.
Before we leave our conversation today, it seems that you would be extremely busy right now.
Right.
You're still seeing patients. Do you have opportunities for people to become patients of yours? Are there openings in your practice?
Absolutely. Yes. Still taking new patients. Yes.
Yeah, and I do. I mean, we will always be the type of practice that limits the number of patients so that we can get people in same day and spend the time that's needed with patients. But yes, we still are taking new patients.
And one last important question is this whole concept of concierge medicine.
Right.
It's part of your practice.
Right.
Can you explain to people what that's all about, and if they're interested, what they would do in order to become part of the concierge medicine practice that you have?
Sure.
And I'll start. I hesitate to use the word concierge because I think it has a little bit of a negative connotation. And what I like to think of it is more of direct primary care, meaning you have a direct relationship with your physician. My patients have my cell phone, my email. They talk to me. They're not having to see other providers. And as Dr. Lynch has mentioned, it's a small practice, whereas in an old practice, I would have to see 30 patients a day potentially. Here, it's less than 10 most of the
Right.
time.
Right.
And patients are able to get in same day, so we're not having to push them off to urgent care. We're also able to deal with the issue and not just brush it off because we have the time to. So for me, it's a blessing to be here. The way I get to really treat my patients and get to know my patients and their families. So I love what I do.
I mean, the biggest complaint you're going to get from people with a primary care provider is that I can't get in. I called up the doctor's office and said, oh, they can see me in 2 weeks. So go to urgent care center, or go to the emergency department, or go to the specialist. I can't get you in. I'm too busy. And it's just not a great model. Primary care docs have become too busy. And I was part of that scene. Mm-hmm. And in this type of practice, and I think this is the model that would work across our country, you have a smaller number of patients, so I can call you when you need to be called. I can get you in when you need to come in. There's less trip to the specialist with this kind of practice, but we can handle a lot of the things here. And when you need to see a specialist, we will get you into a specialist sooner. We help facilitate that. These kind of practices have a 60% lower hospitalization rate because patients are no longer running to the ED for problems. They're being seen by the primary care and seen in real time.
So if people want to learn more information or to sign up for direct primary care, they can call your office and get more information, correct?
Absolutely, yes.
Very, very good.
And we do meet and greets. Patients can come in to
Yes.
just meet us, just to see if this is a good fit for them. And in terms of the price tag on the practice, it's a little less than a cup of Starbucks a day. It's a lot less than a pack of cigarettes a day in terms of the cost on this. So, and concierge is sort of I don't know if it's derogatory is the right
shouldn't
word,
say that.
but it's a term that people think, well, this is for wealthy people. Well, it's not.
No.
It's it's a little less than $5 a day to be part of this kind of practice. Probably not worth it for everybody, but if you have health problems, and health is important to you, it's affordable.
Excellent. Well, I thank you for the time today. This was an excellent informational session, and I hope that our folks stay healthy, and if they are in need, they give you a call.
Great.
Thank you.
Thank you.
Thank you.
Thank you.